Doing okay here?
Yep.
Doing good? Well, a lot of people ask me how this was developed, and I want you to feel confident that it was, in fact, discovered and developed by an endocrinologist. An endocrinologist is a doctor who specializes in your hormones. You may go see him if you have really serious arthritis or for diabetic problems, real serious endocrine issues, different diseases. I'm not going to go into them all. But endocrinologists specialize in what's going on with your hormones. Now, Dr. Simeon was a British physician who had a special interest in obesity and did about 40 years research on it. He ended up opening a spa hospital in Italy where only the rich and the royals could go. And they would go in and lose 40 pounds in 40 days. It was kind of interesting. But how he developed the protocol, and this is of some interest to men especially, is that there was a study done on boys with what's called Froelich syndrome. And Froelich syndrome is where they are not actually kind of moving into puberty as quickly as they should. You may have seen little boys like this. They're maybe 13, 14, 15 years old, and they have kind of large breasts, and their hands are kind of feminine and thin and fine. They may even have abnormal fat around the hips, the buttocks, the thighs, and even stretch marks there from the amount of fat that's there. Dr. Simeon had learned that if you give a rat this hormone, Hcg, you end up with a precocious puberty. And so he was called to India to do research on these boys with Froelich syndrome. He went ahead and gave this hormone to them and found that they very quickly became manly. It changed them pretty rapidly. They were giving shots of women's pee that was pregnant women's urine. That's where they would find this hormone. In fact, this is the same hormone that a woman checks when she does a little test to see if she's pregnant, and she uses that little stick that has urine on it and tells her whether she's pregnant or not. It's measuring whether or not there's Hcg in the urine, and the kidneys will break down the Hcg. So Dr. Simeon was giving these large amounts to these boys, and he was seeing that the fat was moving from off the abdomen into the nice parts of the chest, where in the arms and the hands, making them full and masculine looking. And so he realized that the fat was on the move. If this fat's moving, then it should be able to be used as fuel if you weren't eating too many calories. So he began to experiment with how many calories it would take in order for this fat to be moving and to be utilized before you would start gaining weight with the fat moving or with your diet intake. And he decided that it was 500 calories. At 500 calories, the boys felt full continually, and they were perfectly satisfied to have these 2 meals. And they were becoming quite masculine. Now, the good news about that is if you only have 10 or 15 pounds to lose, you're able to move this fat from the abnormal place where it's gotten stuck. Like a lot of my patients with that small amount to lose will tell me they need to get it off of their belly or just their hips. They have this one place where it's kind of stuck, and they've done everything they can to try and get rid of it, and they can't. So this action of this glycoprotein is able to move it out of those abnormal places into normal places.